Good afternoon et bon après-midi à tous. Thank you for joining us for today's special media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, a reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery, and that button is located on the top right. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez aussi changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est en haut à la droite. Reporters with accessibility needs can pin a net, ASL interpreter, or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler la vidéo de Stéphanie, l'interprète LSQ, ou suivre sur la diffusion en direct sur YouTube. Today, we will be hearing remarks from Councillor Keith Eglai, Chair of Ottawa's Board of Health, and Dr. Brent Mallochny, Associate Medical Officer of Health of Ottawa Public Health. Also on the call is Marie-Claude Turcotte, Program Manager with Immunization, who can answer specific questions about this season's flu vaccine campaign. Nos porte-paroles aujourd'hui sont le conseiller Keith Eglai, président du Conseil de santé d'Ottawa, le Dr. Brent Mallochny, médecin-chef adjoint en santé publique de Santé publique Ottawa. Aussi présente aujourd'hui est Marie-Claude Turcotte, gestionnaire du programme d'immunisation, qui sera en mesure de répondre aux questions reliées à la vaccination contre la grippe cette année. Je passe donc maintenant la parole au conseiller Keith Eglai. Please go ahead, Chair Eglai.
Good afternoon, and thank you everybody for joining us today. As we approach the Thanksgiving long weekend, there are many things we at Ottawa Public Health are grateful for. The amount of support received by OPH from our city colleagues, Ottawa residents, and the community has been a bright spot in an otherwise challenging year. Unfortunately, holidays are going to look and feel different during the COVID-19 pandemic. Today's COVID-19 data is frankly alarming. As of this morning, 183 more people have tested positive for COVID-19 in Ottawa, while the numbers of those hospitalized and in critical care continues to rise. We are falling behind. We don't want to see our schools and economy close this fall and face another lockdown. Prevention efforts are the only way we can slow the crisis in our healthcare system. As such, the city would like to notify residents that as of 2 weeks from today, OC Transpo officials will begin monitoring city buses more closely and providing tickets to anyone not complying with the mandatory mask bylaw. So far, Ottawa residents have pulled together by doing their part and wearing masks when indoor public spaces. And in an effort to bend the curve, residents need to please make sure that masks are worn inside city buses as well. The COVID-19 situation in Ottawa is critical. And as many members of our community plan to celebrate Thanksgiving long weekend, OPH is urging residents to please stay local, keep gatherings to members of your household only, and connect with extended family and friends virtually instead of in person. Although current provincial guidance allows for up to 10 people indoors and 25 outdoors, due to the extent of the COVID-19 transmission in Ottawa, OPH recommends limiting gatherings as much as possible. In other words, limit gatherings to those who live in your household or those providing support services such as a caregiver. If you live alone, a single parent, a student, 1 or 2 contacts outside your home can be important social supports for you to draw upon. This past summer, Ottawa experienced increases in individuals diagnosed with COVID-19 following long weekends, which tells us that higher levels of transmission occurred during these long weekends. These are not normal times, and we appreciate the tough decisions being made by Ottawa residents. OPH has published guidance for social gatherings during COVID-19 on the OPH website to help support residents during the holiday and winter season. We encourage all residents to give the guidance a read through. In the season of giving thanks, we also are reminded of the importance of being kind, and more specifically, COVID kind. Sadly, with the emergence of COVID-19, we have seen rising racism, xenophobia, discrimination, hate incidents, and crimes targeting our Asian communities globally and here in Canada. As a virus, COVID-19 does not discriminate. Anyone can be infected. Evidence has shown that certain groups may be more impacted by COVID-19 than others due to broader health and social factors that increase the risk of contracting the disease. and of being able to protect others. OPH is reminding and encouraging Ottawa residents to remain COVID kind this holiday season by respecting others and taking an extra moment to say thank you to those working in the service industry. Support, kindness, and compassion is what people need now. Lastly, regarding testing, OPH is aware that residents are hearing mixed messages regarding testing. Going into this weekend, OPH would like all residents to know that when they phone the city to inquire specifically about testing, we'll have a recorded message set up that will provide information on testing centers, locations, hours, ages, and how to book online or by phone. With that, I wish you all a healthy, happy, and safe Thanksgiving weekend. Thank you.
Thank you, Chair. Je passe maintenant la parole au médecin-chef adjoint en santé publique. Please go ahead, Dr. Malachny.
Great. Thank you, Chair Egley. Today, we are reporting 183 individuals who have tested positive for COVID-19, yet another record we really don't want to break. Aujourd'hui, nous rapportons 183 personnes ayant obtenu un test positif à la COVID-19, un autre record que nous ne voulons pas battre. We continue to see more hospitalizations, more outbreaks, and most unfortunately, more deaths. Both cases and hospitalizations have doubled since the week of September 13th. We are not seeing the curve slow down. We know it's not something that will happen overnight, but we do know that we have the tools, the knowledge, and the experience to do what it takes to flatten the curve. The more cases that are in the community, the greater the opportunity for the virus to be introduced into our childcare facilities, our schools, and our long-term care and retirement homes. The more cases there are in the community and these vulnerable settings, the more hospitalizations that we will see, and we have seen this past week. We will continue to say, in as many ways as we can, that each of our individual actions matter. Each decision we make will have a direct impact on our community. Earlier today, Ottawa Public Health shared a new infographic of a wedding cluster that shows what can happen when just one person with symptoms of COVID attends a gathering. While in this example, the person had mild symptoms, people are infectious even before they develop symptoms, and some don't develop symptoms at all. The implication is why physical distancing and wearing a mask around others, not in our households, are just so important. In this wedding cluster, that one person led to at least 22 others testing positive, including one person in a group home and more than 200 people having to self-isolate. Just think about the case management involved and think of how many lives that disrupts. Cette infographie montre un regroupement à un mariage. Une personne positive à la COVID-19 s'est présentée au mariage, ce qui a mené à 22 autres à tester positif et plus de 200 personnes devant s'isoler. Please don't think your individual actions don't matter. They really, really do. No one wants schools or businesses to close. It would have a detrimental impact on the financial and mental health of our community. Closures are the last resort. But if we continue down this path, it may have to come to that, as we've seen in other jurisdictions. With regards to gatherings, Chair Egley spoke about Thanksgiving, so I'd like to speak to another significant event that we're approaching, Halloween. I know everyone is anxious for guidance on how to celebrate Halloween as safely as possible. When it comes to hosting a gathering, whether it be a party, a haunted house, or other get-together, much like Thanksgiving, we are asking people to limit their Halloween celebrations to their household contacts. We have to keep in mind that what is happening with COVID in the community. In addition to the province decreasing the maximum sizes of our social gatherings, our COVID numbers are still quite high. More people are testing positive, and we're still seeing an upward trend in outbreaks and hospitalizations. We are in the midst of a significant resurgence, and all of us need to reduce our close contacts in order to flatten this curve. As such, OPH is advising both community officials and residents not to host or encourage Halloween parties or gatherings this year. I also know people are anxious about advice about trick-or-treating. We're monitoring our numbers every day, and we will be able to make a better decision in the next week or so as we get closer to Halloween. We are also awaiting guidance from the province, as this will likely have impact on what we advise locally. But regardless, the same principle applies, in terms of monitoring what's happening in our community before assessing the risk of any large-scale activity or event. Pour l'Halloween, nous surveillons les nombres à chaque jour et nous entendons aussi les directives de la province. Celles-ci auront probablement un impact sur la situation locale. Il en reste que les mêmes principes s'appliquent. Nous devons surveiller la situation dans notre communauté avant d'évaluer le risque d'événements ou des activités de grande envergure. We're asking residents to be creative this year. Create new traditions. Have a scary night with those in your household. Hold a scavenger hunt with your children instead of taking them trick-or-treating. Decorate your house. Dress up in costumes and have virtual contests this year instead of in person. With a little bit of innovation on our side, we can still have an enjoyable Halloween. We continue to update our Be Social Wise page on ottawapublichealth.ca, including advice on safer ways to celebrate your favorite holidays. And of course, we are also approaching flu season. With flu and COVID-19 viruses to be in our community at the same time, there is the potential for more people to become ill this fall and winter and overwhelm hospitals. Our goal is to have as much of the community immunized as possible. Influenza immunization of the population is essential this year. Every year it is, but is of utmost importance this year. Notre objectif est de faire vacciner autant de personnes que possible dans la communauté. La vaccination contre la grippe est essentielle à tous les ans, mais cette année, elle est de la plus haute importance. We may not have a vaccine for COVID-19 yet, but we do have one for flu. So our message to you is this. If you don't normally get a flu shot, please get one this year. OPH has received our vaccines and are in the midst of shipping them to providers, including hospitals, long-term care homes, and community immunization providers. Pharmacies access vaccine directly from the province and are starting to receive them this week. Typically, OPH directly provides more than 11,000 doses of influenza immunizations in Ottawa. The 2020 plan doubles this expected contribution. Later this month, OPH will be offering 3 options for residents to receive their flu shot. OPH community clinics. To avoid crowding and control the flow of clients in and out of these locations, the clinics will be by appointment. Physicians and primary care providers who will be providing flu vaccine to their patients, and targeted immunization clinics for populations facing greater barriers in shelters, group homes, and other congregate settings where residents are not able to access the universal clinics. Pharmacies will also be providing the flu vaccine to Ottawa residents 5 years and older. Santé publique Ottawa offrirait 3 options pour se faire vacciner contre la grippe. Les cliniques communautaires de santé publique Ottawa, les médecins et fournisseurs de soins de santé, les cliniques de vaccination ciblées pour la population faisant face à des obstacles plus grands. Les pharmacies offriront aussi le vaccin contre la grippe aux résidents âgés de 5 ans et plus. More information on these clinics, including the location of the OPH community clinics, are available on our website. Visit ottawapublichealth.ca/flu for this and other information on the flu, including prevention, participating pharmacies, and seasonal reports. Thank you, merci, miigwech, and I wish everyone a safe and happy Thanksgiving long weekend.
Thank you, Dr. Malakny. I will now invite each media agency in reverse alphabetical order today to ask their question. Please remember you have 1 question and 1 follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé. Chacun pourra poser une question et une question de suivi. Je tiens aussi à souligner aux médias francophones que le Dr. Malakny ne peut répondre aux questions en français. Merci de bien vouloir lui poser vos questions en anglais. Nous pouvons également vous transmettre une déclaration en français par courriel suivant le point de presse. Un rappel aussi que Marie-Claude Turcotte répond aux questions par rapport au vaccin de la grippe. A friendly reminder that Marie-Claude Turcotte is on the line with us today to answer questions on the flu vaccine campaign this year. Sans plus tarder, nous commençons avec TVA Gatineau, Ottawa. Renaud Bourbonnais, c'est à vous. Vous êtes toujours en mute. Alors, nous passons à la prochaine question. Ce sera de Radio-Canada. Jérôme Bergeron, vous pouvez y aller.
Oui, bonjour, Madame Turcotte. J'aimerais que vous me parliez de la campagne de vaccination. Quand est-ce qu'elle va commencer et pourquoi c'est important? Un peu comme on a entendu vite fait, là, pourquoi l'importance de se faire vacciner pour la grippe cette année. On sait que c'est pas tout le monde qui y allait à toutes les années, là.
Marie-Claude, vous êtes toujours en sourdine.
M'excuse. Les cliniques communautaires vont débuter à la fin du mois d'octobre. Alors, le 29 octobre, les gens pourront prendre rendez-vous soit sur notre site web ou encore par téléphone. Et pour répondre à votre question, pourquoi c'est si important cette année? Eh bien, comme Dr. Mulofny l'a dit, on n'a pas de vaccin pour prévenir la COVID, mais on en a un pour la grippe. Alors, cette année, définitivement, on espère que le plus de gens possible à Ottawa seront vaccinés pour avoir une grande majorité de la population qui est bien protégée contre le vaccin. Contre la grippe.
Parce que si la population ne se vaccine pas, c'est quoi le risque que vous voyez qu'on engorge les hôpitaux? Pourquoi est-ce que c'est vraiment important?
Bien, écoutez, comme Dr. Mulofny l'a dit, on a déjà la COVID qui circule dans notre communauté. Donc, définitivement, on veut protéger les gens contre la grippe. D'avoir 2 virus qui circulent, comme Dr. Mulofny l'a dit, avoir plus de gens aux hôpitaux. La grippe peut aussi donner des complications. Il y a certaines populations, on le sait, sont plus à risque pour des complications s'ils attrapent la grippe. Alors, définitivement, protéger la population, c'est de plus en plus important cette année.
In English, for doctor, when you see those numbers, a new record today, are you worried to see that?
Did you say, am I relieved with the numbers?
Are you worried, Brent?
Oh, yes. Oh, thank you. It is of concern. I mean, we have seen a number of days now where we have seen increased numbers of cases setting new records. As I said, this is not the direction we want and need to go. Some of the cases that are reported today reflect some older cases due to the testing backlog, but the overall trend is unfortunately upwards. And so I hope that the message that that we're conveying today is that we all need to do our part to reduce our social interactions, which is what's driving this, and to bend this curve because we're seeing the impacts now where the number of cases are leading to more cases in schools and outbreaks there. We're seeing cases and outbreaks in childcare, and we're seeing outbreaks in long-term care and retirement homes. And with the Thanksgiving weekend coming up, and we've seen previous weekends where it leads to a spike, we cannot afford to have a boost given to the current trajectory. What we really need is actually, an absolute reduction in our interactions so that we can reduce this trajectory right now and bend it.
Merci. The next question will be from the Ottawa Citizen, Blair Crawford. Please go ahead.
Good afternoon. I guess this question is maybe to Councillor Egley. We heard about the incident at the Caledon Market the other day. We had the incidents on Elgin Street with the people going into businesses. I'm wondering when the city decides to lay charges for people who are violating the rules, and whether those charges can be laid retroactively, especially in the case of Caledon Market.
Sure. So I'm not going to try and speak on behalf of the police. I know the police were involved in the Caledon Market scenario situation, and they made a decision based on what they saw and what they heard not to lay a charge. So that's a question you'll have to take up with them, why that decision was made. It's way out of public health sort of bailiwick to comment on whether the police should or should not or could have filed the charge in those circumstances. I've seen the video, and but again, that's better directed to OPS.
Okay, for a follow-up question, maybe for Dr. Mulofny, I was in a pharmacy today, and there were long lineups for flu shots. There were signs up saying that the high potency shot was unavailable. I'm just wondering if you have some concerns about shortages of the high potency shot in particular.
Actually, I probably will defer to Marie-Claude in terms of the rollout of the vaccine program.
Thank you. Yes, so the high-dose vaccine, so that's the vaccine that's indicated for people over 65 years of age, is available this year in pharmacies. It's the first time it will be available in pharmacies. It's also available in with physicians as well as Ottawa Public Health. We're not experiencing any shortages at this time. We have vaccines, and we've started shipping our vaccines to physicians and community providers.
Thank you.
Thank you. Our next question, la prochaine question sera de le droit. Je passe la parole à Julien Paquette.
Bonjour. The question is for Dr. Malaki. We've talked a lot of times about the difficulty to manage this pandemic while the daily stats reflect a situation from a week or two ago. Can you talk to me about the situation in the context of, well, maybe heading towards new closure, or like with the way the second wave is hitting us, there might be some new closures. So how difficult it is to make this decision based on data that dates from a week or two ago.
Right. Yeah. No, thank you, Julian. So you're quite right that the cases that you see reported now reflect infections that actually occurred 10 or 14 days ago. Between the time people are exposed to the time they develop symptoms, which is usually around 5 days or so, to the time that they seek testing for the results to come back for us to get them and then report. So it's usually about a 10-day to 14-day period. So that it goes both ways in terms of if things aren't changing and then the infections are still occurring, but of course if people started to reduce their interactions as we changed and our messaging last week and expressed our level, an increased level of concern, then it's still too early to see that. So we need to keep an eye on that. We also need to keep an eye on things like hospitalizations, which take an even longer degree before someone is sick enough to require hospitalization, for example. So it's a useful measure to know what's happening in the community because it's independent of testing. If people get sick enough for hospitalization, they're sick enough for hospitalization in that way. But it's a lagging indicator because it does take a while for it to show up, and it will continue to rise. And so it will be something that we definitely look at. We've talked about in the past the measure of an R in terms of giving some sense of how much transmission is occurring and from one person to the other. And we're really at a point where we have the steady increase, but it wouldn't actually take a lot of change in terms of people reducing their social interactions to be able to bend this. So I think that should be taken as a positive, as a note of optimism that what we're asking isn't impossible. We've done it before. We know how to do it. And so it's certainly quite feasible for us in the upcoming days and weeks to be able to bend this. Now, the converse is also true, and I alluded to it earlier, that if we do things like we've seen in some other long weekends where people come together, it's going to be also riskier this weekend because more likely that if people are coming together, they're going to do it indoors, which is riskier, that it would increase that R value and we would see cases increase even more quickly. So we're at an important point in time here as a community, and it's really about all of us taking a look at our plans, perhaps needing to change them to say, okay, you know what, I plan on a bigger gathering, but we really need to be household, and we'll reach out to people virtually in other ways so that we can still connect. We can still connect with friends and families, but not in the same room and household.
So I guess the follow up to that would be, what will it take to make OPH decide, well, we need more severe measures to control this pandemic. So,
Yeah.
how do we get to this point? Even if we wish, we don't get to this point, obviously.
Okay. So I think that ultimately it's a decision of government. I mean, there's a lot of things to weigh here. I mean, certainly public health can speak to the health impacts and what we are seeing. There are the social and economic impacts that we are also concerned with. But I think ultimately elected officials need to weigh all of the perspectives, and certainly we will provide our advice. We think that there's still an opportunity here for being able to keep schools open, to be able to protect long-term care for at least a while longer. But I think that or if these cases continue to increase, that the options for government will decrease.
Thank you.
Merci. The next question will be from Global News. Craig Lord, please go ahead.
Thank you. This question for Keith Eglai there. You mentioned about the OC Transpo ticketing starting in about 2 weeks' time. Can you describe what the approach is going to be like when OC Transpo staff or special constables will be approaching people to give tickets, especially as it would relate to people who might have a valid exemption from wearing a mask?
Sure. My understanding of the program or the initiative is for the next 2 weeks they're going to be actively out there educating riders, not issuing tickets for the next 2 weeks, but having those discussions, explaining why it's important to wear a mask, and so if you will, a break-in period, kind of like what occurred when the mask bylaw was put in place in the first place. But as more people are using the service, and as Dr. Wagner has alluded to, it's getting colder, the weather's changing, so people who may have been walking to a destination, may have been cycling to a destination, are now going to pivot towards using transit. So we're going to, potentially have more people on transit, which of course is enclosed, and so this is an effort to get ahead of that, to let people know that it's important to wear a mask. And, our bylaw speaks to exemptions, if I can speak to the second part of your question. And tickets are not issued if people indicate that they have an exemption. And that's the way bylaw operates, and I'm quite certain that's going to be the way that the OC Transpo special constables operate as well.
Great. And for Dr. Malachny, just curious why the call on Halloween gatherings now, even before we've had Thanksgiving?
Mainly because we're getting questions. I mean, we were getting questions, a week or so ago, because people are planning Halloween events. And so we want to give them a heads up to say, listen, we're really advising you not to be planning these types of events at this point. And because I don't want them to be wasting their efforts.
Yeah, I can add, with putting on my counselor hat as opposed to my chair hat. I've been getting inquiries for weeks now from people as to what sorts of things are going to be allowable, what they can organize as a community association or a church or a service club. So there's a lot of interest out there around Halloween. And as Dr. Long pointed out, we don't want people to go too far down the organizing road and put their time, effort, and maybe dollars into organizing something that at the end of the day is not going to be allowed to happen. So there is a lot of interest, and I think public health is going to do everything we can to help people create a different kind of Halloween, one that kids will still be able to enjoy, but in a different way, whether that's a virtual costume parade or contest or Halloween art or whatever. But we're going to work with communities to make sure the kids can have some sort of a Halloween this year for sure.
Great, thank you very much.
Thank you. The next question will be CTV Ottawa. Josh Pringle, please go ahead.
Thank you very much. My question's for Dr. Malotny. Just how important is it for people to stay within their households this weekend? You mentioned the curve isn't slowing down. So I guess a two-part question. First off, how important is it for people to limit their contacts this weekend? And how much concern is there that we could see a further spike in cases in 2 weeks if people don't follow the public health directives?
Yeah, no, I mean it's essential that people are limiting their social interactions and staying with their household every day at this point, and even more so over this Thanksgiving weekend when it's a normal time traditionally for people to come together in large groups. So that's why we're reinforcing for this weekend, but quite honestly, it's at this point every day, and all of our actions where we need to be staying with our household, and if we're near other people, we're maintaining 2 meters, we're wearing a mask, and of course not going out if we have symptoms. Now, we've seen in previous weekends where we've had an uptick. And considering where we are now, we just had a record number of cases today, and we had over 100 cases reported yesterday. That we frankly cannot afford an uptick, which could spur a growth rate that's even higher than it is now. So it's really important, and this is the time we, as a community, that we really need to reduce our close contacts and limit our interactions to our households. But reach out to other people virtually, on the telephone, through computers, etc., to be able to still engage with our friends and extended family for this year. This isn't forever, right? This is, we're in the middle of a pandemic. We have a resurgence going on in the Ottawa area. So for this Thanksgiving, we need to do things a little differently, and be with our loved ones in our households, but maintain our distance for other people.
And my follow-up question, Councillor Eglai briefly mentioned about staying local this weekend. Is Ottawa Public Health recommending that people do not leave the city of Ottawa to go visit friends or family, and at the same time recommending that students not leave Ottawa, post-secondary students not leave Ottawa this weekend and try to stay in the Ottawa-Gatineau area?
I can take a stab at that, but I think it's probably better answered by the doctor. But I think our position, and Brett will interrupt me if I get it wrong, but I think our position is, keep your interactions as minimal as possible, both in terms of the number of people and the times that, yes, you are out and about. I can't really speak to the travel piece. I'll let Dr. Malotny speak to that. But I think the general idea is smaller is better this year. It may all mean that we're eating turkey leftovers for the next 3 or 4 weeks, because that's just the way turkey goes. But smaller is better this year for sure. But I'll let Dr. Malotny speak to the travel piece.
Right. No, thanks, Chair. And if you think back to the infographic that we released this morning and alluded to, we really don't want to have another infographic in a few weeks from now showing you a Thanksgiving get together and the adverse impacts in terms of transmission. So it's going to be important to limit our interactions. And I can say that, when we look at cases over the last at least month or so, I mean, some of those transmissions have been with people visiting family, not only in the city, but going to other cities and visiting family members and staying with them, or friends for that matter. So that's an issue with travel, if you're staying with other people. The sort of the university student situation is challenging, because normally they would be part of the household, but the fact that they've been away for a while is they're not. From a COVID perspective, and so my advice would be is that individual decisions are going to have to be made here, I think, in terms of what makes sense for each family, and what the components of the people in that family, in terms of the constituents, in terms of their age and their health situation. I know that for some, they're not. I mean, they're going to socialize from a distance on Zoom or something else. Obviously, that would be the safest from a transmission perspective. I know others where the members of the household have. The university students, for example, or someone in another city have been isolating for 14 days, knowing that they were coming to visit. Moving down into more risky territory is the person does go home, but then they isolate themselves from the family within the household, and that's going to be more challenging, admittedly, in terms of maintaining that 2-meter distancing. Ideally, wearing a mask on both sides of the situation. So I think every family is going to need to make those kinds of decisions going into the weekend. But the basic principle is overall is that your existing household is that's your group to be staying with for the weekend.
Thank you. Our next question will be from CBC News. Natalia Goodwin, please go ahead.
Oh, sorry, I was on mute. So, Dr. Loughney, just on the case numbers, so we saw 90 cases earlier this week. Now we're 180. Can you say that, if we keep going in this, does that mean we'll be at 300 plus in 10 days' time? Is that what we're looking at right now?
It's impossible to say. That's the concern, that if behavior hasn't changed, and at the end of the day, it is around in people's behavior, right? In terms of the interactions that are occurring. So if those don't change and people have continued to have the extent of interactions that have been going on in recent weeks, then yes, would continue to expect, unfortunately, to see higher and higher numbers of cases. Right now, we're doubling our number of cases in a week every 10 to 14 days, and so if nothing changes, that's possible that could occur. And with that, if that were to occur, then that's more and more opportunity for the virus to expose people who are more vulnerable. Because one of the things I would say is that people's perception is that the highest rates are occurring in people in the 20 to 29-year age group and in teenagers, and that's correct. But it's not only those groups. I mean, when I look at today's data, almost 40% of the cases are in people over the age of 40. And once you hit into your 40s, you begin to have an increased risk of serious outcomes. In your 50s, higher risk. 60s, even higher, and it goes up, quite rapidly with increasing decades. So that if people are getting exposed in older age groups, which is what we've seen in other jurisdictions, that eventually begins to occur, and we're beginning to see it here as well, then we'll begin to see more serious outcomes, more hospitalizations, for example, and more ICU admissions. So that's why it's really, really important, and can't stress it strongly enough, that we need to be, reducing our interactions, just socializing with our household at this point in time until we can, bend this curve.
Okay, thank you. And my follow-up, you touched on this in terms of saying that, government will have to make the decision for more closures. But, the City of Toronto's health unit asked to make things more strict. What would, OPH be prepared to ask the province to be allowed to do if we get to that level of, 300 plus cases a day?
Yeah, I mean, I always am challenged by the hypotheticals. I mean, I think we'd have to look at, what are the circumstances? I mean, how many cases? Are there any patterns that we're seeing in terms of what's going on? I mean, at the moment, what we're seeing is it's the social interactions, whether it's in people's homes or sharing a car ride with someone or sharing a meal in a car or too close to at the workplace, in the break room or during lunch. Of course, when people have to take their masks off to eat and drink, but they're not maintaining distancing, or at a wedding, as we saw, or a banquet hall, or all various venues. But the underlying common denominator are the interactions. And I think probably the most important thing, because this is about behavior change, is having really crisp, clear communication. So we've been stressing that to the province, and I think that in recent days it's become much, much clearer. We are trying to, as best we can, in as many ways as we can, be crystal clear that we need to reduce social interactions. We need to just be limited to our households. And if we do that, we can bend this curve. And be able to keep our schools open, to be able to keep our businesses running, because so many people's families and livelihoods depend upon that. So that's really our goal here: is how do we live with COVID while still having as normal an existence as possible, keeping our economy going, keeping children in schools, protecting the vulnerable in long-term care and other congregate settings. And that's the balancing act. So what's the ask of all of us is to reduce our social interactions and just socialize with our households at this point.
Okay, thank you.
Our next question will be from 1310 News. Alex Gouch, please go ahead.
Hello, this is for Dr. Malotny. In terms of, you mentioned canceling your Halloween plans or rethinking Halloween plans. What's your thoughts on trick-or-treating this year? And is there going to be a citywide notice issued on that?
Yeah, so in my speaking notes, I kind of touched on that. I mean, I think that for Halloween, there's sort of two extremes, and those are kind of clear. And let me just review those for a second. So, at one end, which is the riskiest situation, where you would be looking at sort of social gatherings. I mean, we've been talking about social gatherings, right? And so whether it's a wedding reception or a Thanksgiving party or a Halloween party, all of those are a really bad idea right now with the amount of transmission going on and COVID. So we're strongly recommending cancel any sort of Halloween parties of that nature. At the other end of the spectrum, fitting consistently with what we're saying is just socialize with your household, is there a number of things that people can do to still make Halloween fun for kids in the family, where things can be done virtually, the scavenger hunt with your kids, watching a scary movie, pumpkin carving, all those sorts of things are extremely consistent with what we're saying in terms of bending this curve. Trick-or-treating is in between, right? Because you've got the potential for children to be congregating from different households. You have the challenge of them going up to doorways. You have the challenge of transferring candy. So you know what? There's some challenges there. As I indicated earlier, I mean, we're waiting to hear from the province, who have told us that they're going to be providing some guidance for Halloween for the entire province, for all the health units. We want to wait for that so we can see what they have to say. But we're going to have to need to take into consideration what's happening here on the ground in Ottawa and the extent of transmission that we're having. As we get closer to Halloween, we'll provide guidance to folks in terms of what we would recommend in terms of trick-or-treating.
And for my follow-up, what's your opinion on the fine for the house party on Richmond Road, where one person was charged $880 for the party?
I mean, I don't have an opinion. I mean, that's the sort of the responsibility of bylaw services to enforce the provincial orders and regulations. It's concerning, though, that people would be having a large party. We are trying to get through this. As I said, we're trying to keep schools open. We're trying to protect people in long-term care. We're trying to keep businesses open. And having a large party is goes back to what we experienced in July, where we were seeing those events that ended up being super spreader events, where one person was infected going into the party, but we ended up with 8 or 10 people leaving who infected, who then subsequently infected others and introduced it into various settings, which is the way this virus goes. So it's really important that people don't do this, and it's really important that bylaw has an important role in our community to enforce the provincial regulations.
Thank you for your time.
Thank you. I'd like to invite Chair Eglai for any closing comments.
you very much. Yeah, I'll keep it brief. You know, this weekend is the traditional time of year when we sit back and we think about what we're thankful for. And I can tell you, top of mind for me over the last few days has been the people in the city and the way that they have reacted to COVID, and that they have taken good advice to heart, and for the most part followed the advice and the guidance that public health has given out. So I guess my message is this weekend, if we want to show that, then the best way to do that is to keep it small and to interact with your immediate family, connect with others, as Dr. Maloney said, over the phone, over Zoom, whatever computers, program you want to use. There are different ways, but I think we need to be thankful for the great city we have, the cooperative and caring citizens that we have, and the best way to show that, as I say, is to keep this weekend, keep our celebrations small, and connect in different ways. And I think we can. I know we can do that, and that's the best way that we're going to push back against the curve. And I think that's the best gift everybody in the city can give one another is to push back by keeping it small, keeping separate, and moving ahead, following the guidance of the good doctors at public health. So thank you.
And that is all the time we have for today. Merci. Ceci conclut le point de presse aujourd'hui. Bonne journée. Have a good day.
Bonne journée.